Hello everyone. Here we are going to discuss an ultra important topic, that is apoptosis. In the university exams, usually you get a long question. Very frequently you get a long question on apoptosis. So either you get a long question on apoptosis and the examiner will be asking you to write all about the apoptosis. So you have to write the apoptosis along with its mechanisms, along with both the pathways, extrinsic pathway, intrinsic pathway, the morphology of apoptosis, diagnosis, and how we can differentiate it from the necrosis. We have to write everything in the long question. Or else you can get a short question on one of the pathway, either extrinsic pathway or intrinsic pathway. So that is all about apoptosis. We will do it quickly. So let's start apoptosis. Okay, so here you can see we are starting the most important topic here, apoptosis and erythrocytosis. So here, first I will let you know the introduction of apoptosis. Then I will let you know the definition of apoptosis. Then the types, the two types of apoptosis, physiological and pathological. The ultra important thing we have to learn here is the mechanisms. There are two mechanisms, extrinsic pathway and intrinsic pathway, followed by execution pathway, which is common for both of them. And finally, there is erythrocytosis. So we will see the mechanism of apoptosis. Then we will see the morphological changes in apoptosis, diagnosis of apoptosis, and differences between apoptosis and necrosis. I request all my dear students to understand these overview. In every chapter, I have given you this overview. So whenever I give you the overview, I want you to learn this overview so that in the exam, you can recreate your answer under these headings. So what happens normally now when this long question or any long question coming in your exam in second prof, you know everything about it, but you write it as a paragraph. Examiners don't like paragraph. I want, if I am the examiner, I'm checking your copy for second prof, I want the answer to be written under following headings. So if you segregate the answer, first you write down the introduction very neatly, clearly, then you draw the diagram and explain the definition, then tell me the mechanisms with the help of diagrams and the flow charts. Try to draw maximum flow charts, try to draw maximum diagrams, and try to segregate your complete topic under multiple headings. If you are doing so, there is nobody who is going to stop from getting a gold medal or at least getting a distinction in your university exam. Believe me, this is a way you should get oriented. So please learn the overviews, all understand the overviews. The topic I will teach you now, you will not forget. You know the concepts under each of them. Once I will teach you under all headings now, you can recreate in your own words. But only thing you should know under what headings you have to recreate your answer in exam. So this is a way to study the pathology. Got my point? So let's start it. That was a generalized advice for all the topics, not specifically for apoptosis. So let's start it now. So let's start the apoptosis. Let's start with the introduction. So you know that all the cells are in homeostasis. You can see this is a cell. Human body from head to toe, we are made up of cells. All the cells are in homeostasis. They are performing their function normally. They have a normal structure. But whenever any stress acts on it, maybe the stress is physiological, maybe the stress is pathological. Three things happen one by one. The first thing is cell adaptation. Second thing is reversible cell injury, followed by irreversible cell injury. Basically, irreversible cell injury is equal to cell death. If the stress continues, finally the cell will die. Finally, the cell will die. The cell death is of two types, apoptosis and necrosis. Here in this session, we will see apoptosis. I request all my dear students to watch a lecture on necrosis also after this. I am having a lecture on necrosis also in the app. So please watch the two lectures together. So you will get a difference between the two types of cell death. So there are two types by which the cell can do the death. The death of the cell can occur by one of the two mechanisms, either by apoptosis or by necrosis. You may be thinking, what is the difference between them? Ultimately, the cell dying. Yes, in both of them. But the apoptosis is suicide and necrosis is murder. We can compare the apoptosis with suicide. We can compare the necrosis and murder. The person is dying in suicide also. The person is dying in murder also. But the mechanism is different. And why I'm comparing the apoptosis with suicide and necrosis with murder, I will explain when I will explain you the mechanism. You will understand why we are doing this comparison. Ultimately, both are cell death. So what we have learned, cell death is of two types. Irreversible cell injury, that is cell death, is of two types. It can be suicide. It can be murder. So suicide is known as apoptosis and murder is known as necrosis. That is the introduction we have learned. Now let's come on apoptosis. In this session, we will see the suicide. We will see the murder in the next session. You can watch that also. So apoptosis, how to define apoptosis? What's the definition of apoptosis? Now this is a cell. Okay, whenever any cell in human body, this is any cell in human body, it want to commit suicide. This cell want to commit suicide. You may be thinking, ma'am, why this cell want to commit suicide? Nobody wants like to commit suicide. No, I do not want to commit suicide. Why does cell want to commit suicide? There can be two reasons. Number one, this cell is no more required in human body. The function for which this cell was generated, the purpose is fulfilled. Now this cell is no more required in the body, so body will get the signal. Body will send the signal to the cell that you are no more required in human body, in the world. You just commit suicide. So here the signal is coming from outside, and that is number one cause. Secondly, the nucleus of the cell get damaged. The nucleus containing the DNA got damaged to such an extent that it cannot be repaired. So without nucleus, cell cannot survive. So nucleus will send the signal to the cell that you please commit suicide. I'm gone. I cannot be repaired now. I cannot be fixed now. You please commit suicide. So here the signal is coming from inside. So either the cell is no more required in human body, its function is done, or the DNA is damaged to such an extent that it cannot be repaired. In both these situations, cell want to commit suicide. Okay, we got it. Now this cell, when it want to commit suicide, what does it do? Inside the cytoplasm of this cell, there are many enzymes. The most important enzyme here is caspase. There are many type of caspase. Caspase 1, 2, 3, 4, 5. Likewise, there are many caspase, but they are inactive. These are suicide enzymes. They are inactive. So whenever the cell will get the signal, either the body will give the signal that you are no more required, commit the suicide. So here the signal is coming from outside. Okay. Or the DNA is giving the signal to the cell that I am damaged. I am gone. You please commit suicide. So here the signal is coming from inside. Whenever the signal is coming either from outside or from inside, the caspase get activated. The caspase get activated. Once the caspase are activated, what does they do? They convert the cell into multiple apoptotic bodies. Multiple small bodies are formed. You will say, ma'am, what do you mean by apoptotic body? How these bodies are formed? What does they contain? Now in the cell, three things are there. Number one, we have cytoplasm in the cell. Can you see the cytoplasm? Number two, we have nucleus in the cell. And number three, we have a cell membrane. So a little amount of cytoplasm, a little amount of cell membrane, and the nucleus get fragmented, a little amount of the nucleus. It will be distributed equally in multiple small bodies, unequally in multiple small bodies. That is apoptotic body. So each apoptotic body contains a small portion of cytoplasm, a small portion of nucleus, and a small portion of cell membrane. And during this entire process, there is no leakage outside. There is no leakage outside. So immune system will not get activated. So it is very silent. In the end, what will happen? A phagocyte will come and engulf all the apoptotic bodies. A phagocyte will come and engulf all the apoptotic bodies. The cell is disappeared from this world, from the human body. It is silent. Now imagine someone want to commit suicide. What does the person will do? Will the person take a mic, a loudspeaker, and announce everywhere, hello, I'm committing the suicide? No. Suicide is silent. It is done personally, silently, privately. Okay. So it is like that. So this cell, when the cell is committing the apoptosis, there is no leakage. So immune system will not get activated here, and the cell silently disappear from human body. That's why we are comparing the apoptosis with suicide. The suicide is done by one person. Murder can be, the multiple person can be murdered at a time with the help of a gun or anything, right? Like that. But suicide is usually done by one person. Okay. So apoptosis occurs in one cell, but necrosis occurs of a group of cells. In apoptosis, it is silent. There is no rupture of the cell membrane. Cell membrane is intact. There is no leakage. Inflammation do not take place. But in necrosis, cell will rupture. Everything will leak out. So it will stimulate the inflammatory system. Inflammation will take place. So here inflammation is absent, it's silent. And there in necrosis, inflammation is present, it's active. How many of you got it? So this is the definition. Let me show you. Can you see the cell? This is the apoptotic cell. You all can see the complete cell is there. It is getting converted into multiple small apoptotic bodies. And during the complete cell, when it is converting into multiple small apoptotic bodies, there is no leakage outside. The cell membrane remain intact and there is no leakage outside. Each of the apoptotic body contains a small portion of cytoplasm, a small portion of the nucleus, and a small portion of the cell membrane. This is apoptosis. Here also you can appreciate the same. Appreciate the cell. Now this cell got the signal either from outside that it is no more required, or from inside that the DNA is damaged. Now you see the nucleus get fragmented into multiple pieces, and now multiple blobs are formed. Now multiple apoptotic bodies are formed. Each apoptotic body contains a small portion of nucleus, a small portion of cytoplasm, and a small portion of cell membrane. So this is how the apoptosis takes place. So define it. Now please define in your own words. Don't try to mug up. Please define in your own words. So what is apoptosis? It's a type of cell death. It's a programmed cell death. It's a tightly regulated programmed cell death in which the cell which is destined to die, it will activate an enzyme caspase. And caspase convert the cell into multiple apoptotic bodies. A phagocyte will come and engulf all of them. There is no leakage, there is no inflammation, it's silent, like the suicide. That's why we compare it with suicide. So you have to write down, we compare it with suicide because it is silent. There is no leakage, there is no inflammation, in contrast to necrosis, in which there is leakage, there is inflammation, the other type of the cell death. So define it. So how to define? What's the definition? So apoptosis is the type of cell death in which the cell which is destined to die, it's a programmed cell death, in which the cell which is destined to die activate an enzyme which is known as caspase. Caspase will convert the entire cell into multiple small apoptotic bodies. During the entire process, there is no leakage, there is no inflammation, it's silent. That's why we compare it with suicide. So try to frame in your own words. I never learn pathology. I just understand it and frame in my own words, and I can get the gold medal as well as distinction. Got my point? So this is the way. So you can draw the diagram also. Okay, now what are the types of apoptosis? There are two types of apoptosis, physiological and pathological. What is physiological? What is physiological? Occurs in human body normally. So during embryogenesis, have you ever thought how our hands are formed? Can you see our hands? There are 5 digits. You can see there are 5 digits in our hands. So initially, whenever during embryo life, the hand is formed like a block. Can you see? It's like a complete block. There is a complete block. And then the digits are formed. Now, how the digits will be formed in a block? So between 2 digits, the cell undergo apoptosis. Can you see the cells here? The cells here undergo apoptosis. The cells here undergo apoptosis. So the 5 digits get separated like this. So during embryogenesis, not only in hands, in multiple organ formation, apoptosis takes place. It's physiological. So apoptosis takes place during embryogenesis. One of the best example I have quoted here. So hands are formed. The digits in the hands are formed. Initially, it was like this. It's a block. Now the cells between these 2 digits, they undergo apoptosis. Between these two, they undergo apoptosis. Between these 2 digits, they undergo apoptosis. So the digits get separated. In this way, in the physiology, apoptosis takes place for physiological function also. Right? Now there are lymphocytes in human body, B lymphocyte and T lymphocyte. Why God has given lymphocytes? It's the army. So whenever any foreign particle come, they get activated and kill the foreign particle. But sometimes they become mad. I mean, they become self-reactive. They start killing their own tissue, autoimmunity. So if some lymphocyte become mad and start killing the body's own tissue, the body kill that lymphocyte via apoptosis. So that is also physiological. Okay, so learn the 2 examples of the physiology, embryogenesis and apoptosis of self-reactive lymphocytes. Pathological, you can see HIV is a virus. HIV virus causes the apoptosis of CD4 T lymphocytes in human body. And chemotherapy drugs, chemotherapy in cancer patients. So chemotherapy drugs treat the cancer patient by causing apoptosis of the tumor cell. So please learn that is pathological. So learn the examples of the physiological and pathological. We are done with definition of apoptosis and the 2 types of apoptosis. Now coming on mechanism. The ultra important here is the mechanism of apoptosis. In the mechanism of apoptosis, there are 2 pathways, extrinsic pathway and intrinsic pathway. Please understand. What do you mean by extrinsic and intrinsic? See, this is the cell. This is the cell, this is the nucleus of the cell, this is the DNA of cell. Listen, now this cell want to commit suicide. Now signal can come via 2 ways. If the signal is coming from outside, that you have to commit suicide, it is known as extrinsic pathway. Extrinsic means signal is from outside. Extrinsic, the signal is coming from outside and giving the signal to the cell that you have to commit suicide. Sometimes the signal is coming from inside the cell when the DNA got damaged. So here also signal is coming. But signal is from inside the cell. The DNA is giving the signal that I am damaged. You just commit suicide. So this is known as intrinsic pathway. So basically in extrinsic pathway, the signal comes from outside, and in intrinsic pathway, the signal comes from inside. So please learn that. That is the, you can understand, that is the 2 type of pathway, extrinsic, intrinsic. Now in each pathway, there are two phases, initiation, execution. So I will teach you all. Now listen. First, I will start with the extrinsic pathway. I will start the initiation phase of the extrinsic pathway. Then I will move on the intrinsic pathway, the initiation of the intrinsic pathway. Then I will teach you execution of both of them together, because execution of both of them is convergence. So first I will teach you extrinsic pathway, initiation phase. Then I will teach you intrinsic pathway, initiation phase. And finally, I will teach you execution of both of them together, because execution is a common finding. So we will cover the mechanism in 3 steps. First, we will see the initiation of extrinsic pathway. Then we will see the initiation of intrinsic pathway. And then we will see execution pathway of both of them together. So let's start the extrinsic pathway. where the signal will come from outside, and initiation phase. So you know this is a human cell. This can be any of the human cell. On the surface of the human cell, can you see the red colored death receptors are present? These are inactive. These are known as death receptor. Can you see the red color? They are present at a distance from each other. These all are death receptor. They are present at a distance from each other. They are present at a distance from each other. These are known as death receptor. Two type of death receptors are there. One is FAS, also known as CD95. FAS or CD95, and second is TNF, tumor necrotic factor. So please learn either FAS, CD95 or TNF. The two type of death receptors are present. They are inactive. They are inactive. Now this cell have performed its function in the body. The purpose is done. Now the body is sending the signal from outside. See, the signal is coming from outside because I am teaching you extrinsic pathway. Here the signal comes from outside in the form of the ligand. So body is sending the signal in the form of the ligand, that is FAS ligand. So FAS ligand is coming. FAS ligand is coming, and FAS, let me zoom out this. So you can see this is the cell. You can see these are the death receptors. Appreciate the death receptors. FAS or CD95, you can see. So here the FAS ligand is coming from outside and binding with the FAS receptor. So here signal is coming from outside. Once the FAS ligand come and bind with the death receptor, as soon as this binding takes place, multiple FAS receptor come together. You can see now they are far apart from each other. No. So as soon as the ligand bind with the receptor, this is ligand, it is binding with the receptor. As soon as it is binding with the receptor, multiple FAS receptor come closer and they will form a domain. It is known as death domain. What's the full form? FAS associated death domain. It is known as FADD. Say the full form. FAS associated death domain, FADD. So when this ligand bind with the receptor, multiple receptor come closer and they form a death domain, that is FAS associated death domain. Now in the cytoplasm, you can see multiple caspase are present. Caspase 1, 2, 3, 4, 5, they all are inactive. So as soon as FADD is formed, FAS associated death domain. So out of multiple caspase, caspase 8 get activated. So the first caspase which get activated is caspase 8. The story is over. The same you can see it here. Can you see the cell membrane? I want you to appreciate the cell membrane here. Can you appreciate the cell membrane? This is the cell membrane. On the surface of the cell membrane, these are the death receptors. So when the FAS ligand is coming, can you see here the FAS ligand is coming? FAS ligand is coming, binding with the death receptor, multiple death receptor come closer. As soon as they come closer, they form a domain known as FADD, and it is activating the pro-caspase 8 into active caspase 8. So the same you can write in the form of the flow chart. Don't write paragraphs, write flow chart in university exam. Please highlight it. So FAS ligand is there. It is binding with the FAS receptor. Multiple FAS receptor come closer. They form a domain known as FAS associated death domain, and it converts pro-caspase 8 and sometimes 10 also into active caspase 8 and 10. So 8 and 10 are the first caspase which get activated in extrinsic pathway. You get an MCQ on this also. So we are done with the initiation phase. What's the end result here? Don't forget the end result. It is activation of caspase 8 and 10. You will say, ma'am, what's ahead? What's ahead? So the story ahead I will tell you in execution pathway, but later on. This is an intermission. I will tell you the story later on. Let me tell you one more story. So one more story, I will tell you the initiation of the intrinsic pathway now. And then I will combine the two stories, this story and this story together. I will pack the two stories together in execution phase. So let me come on the initiation of the intrinsic pathway now. So I'm starting the intrinsic pathway. I'm telling you the initiation there. Now, can you see a cell in front of you? Please appreciate the cell. Now in this cell, this is a cell, I guess everyone can see. This is the nucleus of the cell. This is the double-stranded DNA of the cell. You can see the mitochondria. You can see the two membrane of the mitochondria, inner membrane of the mitochondria, outer membrane of the mitochondria. Between the two membranes of the mitochondria, there is a protein cytochrome C. Cytochrome C never comes out in the cytoplasm. It remains in the space between the two membranes of the mitochondria. Once the cytochrome C will come out, now apoptosis will occur. Okay, so let me zoom out this cell. Let me zoom out this cell. You can see the zoom version of the same. So you should ask me a question, or you should think your question that, ma'am, why cytochrome C is not coming out? In the mitochondria, there is permit. There is transit. This is the transit. Transit is the door. We can say the transit is the door of the mitochondria. Why not cytochrome C is leaking out of this transit? Why? Who's preventing? Is there someone who's preventing the cytochrome C to come out? Yes. There are 3 guards. The God has provided 3 guards there. The guards are sitting there, which prevent the cytochrome C to come out. They close the door. They do not allow the cytochrome C to come out. What are the 3 guards? Learn the name. It's BCL2, BCLX and MCL1. That is the 3 guards that are preventing the cytochrome C to come out. So cytochrome C cannot leak out. No, it cannot leak out. Got my point? So cytochrome C cannot leak out because of the guards. These are known as anti-apoptotic proteins. anti-apoptotic guards, anti-apoptotic proteins, because they are preventing the apoptosis. Till now, everything was normal. Everything. Now, DNA of this cell get damaged. DNA of the cell get damaged due to some external influences, some external agents, some external carcinogenesis. So physical, chemical, biological, different agents are causing the damage to the nucleus. It cannot be repaired. It's too much damage beyond repair. Now this DNA, damaged DNA will give the signal to the mitochondria that I'm gone. Initiate the process of the suicide. Let's do the suicide of the cell because I'm gone. I cannot be repaired. Got my point? So this DNA is giving the signal to the mitochondria that I'm gone. Please initiate the suicide. Got my point? So here signal is coming from inside of the cell. That's why it's intrinsic pathway. It is not coming in the form of the ligand, as in contrast to the last extrinsic pathway. So as soon as the mitochondria get the signal that I have to commit the suicide, so mitochondria will replace the guard. So these guards are replaced by these guards. So initially the three guards, that is BCL2, BCLX and MCL1, they close the door. They close the transit. They do not allow the cytochrome C to come out. Now they are replaced by another guards. The another guards are BARX, BIM, BAD. They open the door and they allow the cytochrome C to come out. So these are anti-apoptotic proteins and these are pro-apoptotic proteins. So on receiving the signal, the anti-apoptotic proteins are replaced by pro-apoptotic proteins. I repeat, on receiving the signal, the anti-apoptotic proteins are replaced by pro-apoptotic proteins. These guards are replaced by these guards. So initially the guards were closing the door. Do not allow the cytochrome C to come out. Now the guards will open the door and they allow the cytochrome C to come out. So you can see cytochrome is leaking out. Cytochrome is leaking out and coming in the cytoplasm. So what does it do in the cytoplasm? In the cytoplasm, I told you there are many caspases are present, but they all are inactive. Caspase 1, 2, 3, 4, 5, 6, 7, 8, and so on. Many caspases, but they are inactive. So one of the caspases is caspase 9, procaspase 9. It is inactive. You can see one of the caspases is caspase 9, procaspase 9. It is inactive. Why it is inactive? Because it is in combination with a protein. It is known as APOF1, apoptotic activating factor. Apoptotic activating factor, APOF1. So they are a couple. They always travel together. Now there is a rule. Till APOF1 is binded with procaspase 9, it cannot be activated. It cannot be activated. So APOF1 is preventing caspase 9 to get activated. So if you want to activate caspase 9, you have to separate the couple. You have to split the couple, I mean. So that's what cytochrome C will do. As soon as cytochrome C will come out, cytochrome C will take the APOF1 with him. Cytochrome C will take APOF1 with it. So procaspase 9 will become alone and it will get activated. So basically cytochrome C is activating the caspase 9. So caspase 9 is the first caspase which get activated here. So the same story is shown to you here. So you have to write the same which I have shown you in the form of the diagram, in the form of the flow chart. Never write paragraphs in university exam. Never ever. Write in the form of the flow charts. So whenever there is a DNA damage, it is giving the signal to the mitochondria. So DNA damage is the signal. It is giving the signal to the mitochondria. So anti-apoptotic are replaced by pro-apoptotic. On receiving the signal, anti-apoptotic proteins are replaced by pro-apoptotic proteins. That is BCL2, BCLX, MCL1. These guards which were closing the door. They were closing the door. They are replaced by another guards. That is BARX, BAD, BIM, BAD. They open the door. They open the door. As soon as they open the door, by door I mean the permeability. I mean the transit, mitochondrial transit, they open the door. So cytochrome C will leak out. Once cytochrome C will come out, it will take APOF1 with it and the procaspase 9 will become active. So caspase 9 is the first caspase which get activated here. So who was the first caspase which was activated in extrinsic pathway? It was 8 and 10. And who's the first caspase which is activated in intrinsic pathway? It's caspase 9. So learn the first caspase, you get MCQs on that. So the first caspase which get activated in extrinsic pathway is 8 and 10. And the first caspase which activated in intrinsic pathway is caspase 9. So draw the diagram here, draw the flow chart, draw the diagram here, draw the flow chart, and this is the story. Now let me combine what's ahead in a common story. The common story is execution pathway. So let's start execution of both of them together. So I'm teaching you a common execution which belongs to extrinsic also, intrinsic also, a common execution. So execution pathway is the convergence point between the extrinsic and intrinsic, both of them. So in extrinsic pathway, the first caspase get activated is 8 and 10 with the help of death receptor, FADD, death receptor, remembering that pathway. And in intrinsic pathway, the first caspase which get activated is caspase 9 because of cytochrome C. Here the main molecule is cytochrome C which is causing activation here. Here the main thing is FADD. Ultimately here caspase 8 and 10 and here caspase 9, they activate another caspase. Another caspase is 3, 6, 7 and all the caspase get activated. Whatever is the mechanism, once all the caspase get activated, the cell will convert into apoptotic bodies. Can you see here? This is a cell. Inside the cell, the caspases get activated. Now, either it is by extrinsic pathway, the signal is coming from outside, or it is intrinsic pathway. Ultimately, if it is extrinsic pathway, the first caspase is 8 and 10. If it is intrinsic pathway, the first caspase is 9. Ultimately, all caspases are activated. They convert the cell into multiple small apoptotic bodies. In the end, a phagocyte is coming. In the end, a phagocyte is coming. This is the phagocyte, and engulfing all the apoptotic bodies. And during the entire process, no leakage outside, no inflammation. Inflammation is characteristically virtually absent in apoptosis, which differentiated from necrosis, the other type of cell death. Please learn. So you can see the cell is converting into multiple small apoptotic bodies. Each apoptotic body contains a small portion of the cytoplasm, a small portion of the nucleus, a small portion of the cell membrane. So entire cell convert into multiple small apoptotic bodies. In the end, a phagocyte will come and engulf all of them. Let me show you. Can you see a phagocyte? It is coming. And can you see the cell get converted into multiple apoptotic bodies? Now these all apoptotic bodies will be engulfed by the macrophage. Can you see? The macrophage is engulfing. So macrophage has done the clearance. It is cleared. So cell is virtually cleared from the body. Silently. No leakage, no inflammation. Macrophage is coming and engulfing all of them. So this is the macrophage you can see here. It is coming here. You can see the macrophage is moving here. See it again. So here is the macrophage. It is coming here. Can you see it is coming? It is moving. And the macrophage will engulf all the apoptotic bodies. Appreciate the macrophage is engulfing all the apoptotic bodies. Okay. So it is silent. I mean, no leakage, no inflammation. This is the last step. So that is phagocytosis. This is the last step, which is known as ephrocytosis. So whether extrinsic pathway or intrinsic pathway, last step is phagocytosis, and phagocytosis in apoptosis is known as ephrocytosis. So ephrocytosis is basically phagocytosis. Let me ask you a question. Okay, this is a phagocyte. Let me ask you a question. Let me see who can answer. This is a phagocyte. Okay, now this is a normal cell, healthy cell. Normal cell, healthy cell. And this is an apoptotic cell converted into apoptotic bodies or about to convert into apoptotic bodies. About to convert or apoptotic bodies are there. Now, phagocyte do not engulf this cell. No, healthy cell. It do not engulf the healthy cell. But phagocyte will engulf the apoptotic cell. But phagocyte don't have eyes. The phagocyte will see, oh, this is a apoptotic cell, I have to eat it. And this is a healthy cell, I don't have to eat it. Phagocyte don't have eyes. No. So how does the phagocyte recognize that this is apoptotic cell and I have to eat it? And this is a healthy cell, I do not have to eat it. Why? How? This is ephrocytosis. This is ephrocytosis. Listen, on the surface of healthy cell, there are certain signals which are known as do not eat me, not eat me, do not eat me, that repel the phagocyte, and they indicate do not eat me, I am a healthy cell. And on the contrary, on the surface of apoptotic cell, apoptotic bodies and apoptotic cell, eat me signals are there. Eat me. यहाँ पे not eat me signals are there, and यहाँ पे eat me signals. Eat me signals attract the phagocyte, and it will indicate the phagocyte that we are apoptotic cell and engulf us. So what are the name of these signals? Not eat me and eat me. So you got my point. That is ephrocytosis. Ephrocytosis means immunologically silent clearance of apoptotic bodies by the professional and non-professional phagocytes. The professional and non-professional phagocytes are known as ephrocytes. So you can see this is a healthy cell. Healthy cell have eat me signal on that. Don't eat me signal on that. So don't eat me signal is CD47. Can you see the signal? It's CD47. CD47 repel the phagocyte. It is don't eat me signal. It indicates that I am a healthy cell, don't eat me. So that's why phagocyte do not come here and do not eat them. On the contrary, on apoptotic cell, can you see this is a apoptotic cell? This is the cell membrane of apoptotic cell. Normally, all the cells have a phospholipid on the inner side of the cell membrane. Can you see here on the inner side of the cell membrane there is a phospholipid. The name of this phospholipid is phosphoridylserine, PS. Phosphoridylserine, it is present on the inner side. But whenever the cell get converted into apoptotic body, flip-flap takes place. Flip-flap. Ulta pulti, flip flap. So whatever present on the inner side comes on the outer side. Okay. So this phosphoridylserine will come on the outer side. And this phosphoridylserine will act as the eat me signal. So it will attract the phagocyte. Can you see here the phagocyte is coming and it is attracting and it will eat this cell. So what is do not eat me signal? This is a healthy cell and this is a apoptotic cell. Okay. This is a healthy cell. This is a apoptotic cell. Healthy cell. And this is apoptotic cell, and this is a phagocyte. So tell me the name of the receptors. Healthy cell have CD47 that repel the phagocyte. This is known as don't eat me signal. Don't eat me signal. And on the contrary, apoptotic cell have phosphoridylserine that attracts the phagocyte and asks the phagocyte to engulf them. So this is known as eat me signal. Eat me signal. So this is phosphatidylserine, which is usually present on inner side, but in apoptotic body, it comes on the outer side. So learn the name of don't eat me signal and learn the name of eat me signal. Don't eat me is CD47, eat me is phosphatidylserine. I hope you got it. This is efferocytosis. So same story is written. Eat me signal. Normally phosphatidylserine is present on the inner surface, but during apoptosis, it is flipped to the outer surface. It is known as externalization of phosphatidylserine, and it is eat me signal. It will attract the phagocyte to engulf it. So we are done with initiation of both of them, execution of both of them, and finally efferocytosis. We are done. So you can see this is a cell. It want to undergo suicide. So it got a signal either from outside or from inside. Ultimately, it got converted into multiple apoptotic bodies. In the end, a phagocyte come and engulf all of them silently. No leakage, no inflammation. So this is apoptosis. Now I'm telling you the morphological changes in apoptosis. There are 6 morphological changes you have to learn in a sequence. Please learn the sequence. This is a healthy cell. You all can appreciate this is a healthy cell. The first thing it undergoes shrinkage. See, the size is reduced. The first thing it undergoes cell shrinkage. The first thing. Now since it is undergoing cell shrinkage, on the cytoplasm of the cell, there are various cell organelles. There is mitochondria, endoplasmic reticulum, ribosomes. When the cell undergoes shrinkage, the multiple cell organelle come closer, closer, closer. Since the multiple organelles come closer, the cytoplasm look more pink in color. You can see the cytoplasm look more pink in color. So it is known as eosinophilia. So first there is cell shrinkage, which leads to eosinophilia. First there is cell shrinkage. It leads to eosinophilia. Got my point? That is the second thing, eosinophilia. The third thing, 2 things will happen in the nucleus. The nucleus undergo pycnosis. It will undergo condensation, and followed by nucleus undergo fragmented into multiple pieces. Fragmentation is known as karyorrhexis. So pycnosis and karyorrhexis is the third feature. So first there is cell shrinkage, then there is eosinophilia. It becomes more pink in color. So first cell becomes shrinked, earliest feature. Then the cytoplasm becomes pink in color, that is eosinophilia, followed by nuclear features, that is pycnosis and karyorrhexis. After that, in the cell membrane, blebs are formed. These are the blebs which are formed in the cell membrane. Then the blebs will separate from the main cell, taking a small portion of the cytoplasm and small portion of nucleus. So multiple apoptotic bodies are formed. In the end, a phagocyte will come and engulf all of them. So these are the 6 features. Can you enumerate the 6 features together? Tell me the morphological features of apoptosis. 6. 1, 2, 3, 4, 5, 6. So first feature is cell shrinkage. Because of cell shrinkage, the cell organelle come closer and the cytoplasm become pink in color, that is eosinophilia. Then 2 things in the nucleus, pycnosis and karyorrhexis. The nucleus get fragmented, first condensed, then fragmented. Then blebs are formed. Then bleb will separate from the cell, that is apoptotic bodies are formed. And finally, the phagocyte will come and engulf all of them, phagocytosis. Now 2 questions to answer. Tell me the earliest and tell me the most specific. I guess everyone knows the earliest. Earliest is very easy to tell. You get a question MCQ on that. Earliest change in apoptosis is shrinkage, never swelling. Swelling occurs in necrosis. Here cell shrinkage occurs. And most specific is the characteristic or pathognomatic feature is the nuclear change. So specific feature is pycnosis and karyorrhexis. So 2 different MCQs are framed here. Earliest feature is shrinkage and specific or characteristic feature is the nuclear changes, that is pycnosis and karyorrhexis. Now coming on the diagnosis of apoptosis, there are 2 ways to diagnose the apoptosis. How we can diagnose the apoptosis? There are 2 ways. Number 1, there is the apoptotic marker. The name of the apoptotic marker is annexin 5. The name of the apoptotic marker is annexin 5. So I told you, normally, can you see this is the cell membrane? Now see the phosphatidylserine present on the inner surface of the cell membrane. Normally, I told you phosphatidylserine is a phospholipid present on the inner surface of the cell membrane. But during apoptosis, due to the flip flap, can you see some of the blue are coming on the outer surface? Some of these blue phosphatidylserine, it is coming on the outer surface. Now annexin 5 is a marker which bind with the phosphatidylserine. So in a normal cell, it do not bind. But in a apoptotic cell, it will bind. So this is a normal cell. This is the apoptotic cell. This is a normal cell. And this is a apoptotic body or apoptotic cell. Apoptotic cell. So here phosphatidylserine present on the inner surface. And here due to the flip flap, it came on the outer surface. Some of it came on the outer surface. Here it is present on inner surface. So if you give the annexin 5, it will bind with phosphatidylserine. So here it cannot bind, but here it can bind. So annexin 5 is a marker that will highlight the apoptotic cell, and you know the principle behind that. Number 1. Number 2, you can do agarose gel electrophoresis. Agarose gel electrophoresis. Got it? Number 2, you can do the agarose gel electrophoresis. Got it? So here, this is a normal cell. This is the nucleus of the normal cell. And here, the apoptotic cell. In apoptotic cell, the nucleus undergo fragmented. We know carrier access. Now, whenever do the agarose gel electrophoresis, here DNA is in continuation. And here DNA get fragmented into multiple pieces. So here you can see if it is in continuation, it is like this. It's like this. It's in continuation. The complete DNA is long. It's in continuation. This is a ladder which we use to compare the length. This is a ladder on the agarose gel electrophoresis, a comparative ladder. So see cell number 1, cell number 2 and cell number 3. You can see the cell number 1, the complete DNA is in one portion. But in cell number 2 and 3, you can see it is fragmented into multiple portions. It is fragmented into multiple portions like that. So a step ladder appearance is there because the nucleus get fragmented into multiple pieces with the help of an enzyme endonuclease. So it is known as step ladder pattern. Can you see it is looking like a ladder? So if you take a normal cell, here the complete DNA is in one portion. But if you see a apoptotic cell, the DNA get fragmented into multiple portions. So here the complete DNA at one place, here the DNA is in multiple fragments. So we get a step ladder pattern here in apoptotic cell. We get a step ladder pattern in apoptotic cell. So these are the two ways by which we can do the diagnosis. Annexin 5 as a marker and agarose gel electrophoresis. Finally, tell me the differences between apoptosis and necrosis. Can we say the differences between them? Apoptosis is suicide, necrosis is murder. Okay, suicide is done by one person. Murder can be done of multiple persons. So apoptosis occurs on single cell, but necrosis can occur in a group of cells. In apoptosis, cells shrink. Cell is doing the shrinkage. So there is no disruption of the cell, no leakage, no inflammation. Here the cell will swell, and cell will burst. Cell will swell, cell will burst. Leakage is there, inflammation is there. So here no leakage, no inflammation. Here leakage is present, inflammation is present. Here this is normal cell. Here it shrink and here it swell. Once it swell, it will rupture. So this is the differences between them. Appreciate apoptosis and necrosis. Let me show you. Apoptosis, which we compare with suicide. Necrosis, which we compare with murder. In apoptosis, the cell will shrink. Appreciate, and it will convert into multiple apoptotic bodies. See it again. The cell will shrink and it will convert into multiple apoptotic bodies silently. During this, no leakage, no inflammation. No leakage, no inflammation. Silently it get converted into multiple apoptotic bodies. There is no leakage, no inflammation, and a phagocyte will engulf all of them. On the contrary, have a look on the necrosis, in which the cell is swelling and it is bursting. See, bursting. Once it is bursting, you can see the cytoplasm is leaking out. So leakage is present, inflammation is present. See, it is bursting. So here shrinking, here swelling. Here no leakage, no inflammation. Here leakage is there, inflammation is there. So this is the thing. So we are done with apoptosis. Now if a long question is coming, you can write it very well. So what is the introduction? You tell me apoptosis is a type of cell death. There are two types of cell death, apoptosis and necrosis. What's the definition of apoptosis? It is a type of cell death, programmed cell death, in which the cell which is destined to die activate caspase. And caspase convert the cell into multiple apoptotic bodies. A phagocyte will come and engulf all of them. Silent, no leakage, no inflammation. Now tell me the extrinsic pathway, draw the flow chart. Intrinsic pathway, draw the flow chart, initiation phase of both of them, and finally execution phase, and finally efferocytosis. Morphological features, you have to mention the 6 morphological features in a sequence. Cell shrinkage, eosinophilia, then the nuclear changes, pycnosis, carrier access, okay, followed by black formation, apoptotic body, and phagocytosis. Learn the most common, most specific. Diagnosis of apoptosis, 2 ways are there. Number 1, annexin 5 as a marker, and agarose gel electrophoresis. Draw the diagrams. In the end, draw the difference table between apoptosis and necrosis. So if you are drawing all the flowcharts here, all the line diagrams here and flowcharts here, you are going to get full marks in apoptosis. Believe me. This is a way you have to write apoptosis. I hope I told you very easily. Now apoptosis become cakewalk for you. Yes or no? Yes. So that's all about it. Thank you so much. Don't forget to have a look on long, short and very short questions, MCQs of this topic, which are given in the question bank section, as well as notes of this topic. Have a look right now so that you will get confident that you know everything about it. If this question is coming, you are prepared. Thank you so much. All the best.